Doctor, I was recently told during a health checkup that my blood sugar levels are high and that I should visit the hospital. I understand that I need to improve my diet, but is there anything else I should be aware of? I've been researching online and it's starting to scare me a bit.
Don't worry. Today, I'll be discussing is too much salt intake linked to diabetes? This video will explain the relationship between diabetes and salt intake in detail. Please subscribe to the channel and watch the video. Also, don't forget to click the like button.
Yes, please tell me. I'm really worried.
Sure, let's start with the basics of diabetes. Diabetes refers to a condition where the body's ability to control blood sugar levels doesn't function properly. High blood sugar can have various adverse effects on your body.
What are the adverse effects of high blood sugar?
Prolonged high blood sugar can increase the risk of complications like nerve damage, kidney damage, and eye diseases. This is the concerning aspect of diabetes. However, by improving your lifestyle, you can significantly reduce these risks.
I see, improving lifestyle habits is important. But I'm curious about how too much salt intake affects diabetes.
That's covered in detail in the video. Simply put, excessive salt intake can raise blood pressure, which in turn increases the risk of diabetes. High salt intake can also stimulate appetite, leading to overeating, which contributes to the problem.
I understand now. Watching the video should help me understand better.
Yes, please watch it and apply the information to your daily life.
Thank you. Can you explain in detail how excessive salt intake affects diabetes? I've researched online, but I'm still confused.
Of course. Excessive salt intake, or sodium, disrupts the body's fluid balance and raises blood pressure. This increase in blood pressure can be a contributing factor to the risk of diabetes.
Does high blood pressure make diabetes more likely?
Yes, it does. High blood pressure can damage blood vessels and hinder the action of insulin. If this condition persists, the risk of developing diabetes increases. High blood pressure leads to insulin resistance, making it harder to control blood sugar levels. So, maintaining a healthy blood pressure is crucial for diabetes prevention.
That's concerning. Are there scientific studies on this?
Yes, numerous studies have been conducted. For example, some research shows that high salt intake increases the risk of developing diabetes. This is due to the combined effects of salt on blood pressure and glucose metabolism.
So, reducing salt intake is really important.
Exactly. Reducing salt intake not only helps prevent diabetes but also heart disease and stroke. Being mindful of your daily salt consumption is a critical step in maintaining your health.
How can I reduce my salt intake specifically?
One way is to limit processed foods and eating out, and try cooking more at home. When you cook, use low-sodium seasonings and include plenty of fruits and vegetables in your meals. Also, savor your food slowly to feel satisfied with less salt.
I see, small daily efforts are key. Can reducing salt really improve blood pressure and lower the risk of diabetes?
Yes, reducing salt is very effective for improving blood pressure. Excess sodium is a major cause of high blood pressure. Lowering salt intake reduces blood pressure and, consequently, the risk of diabetes.
Are there scientific bases or research results about the benefits of reducing salt?
Yes, many studies support this. For instance, research shows that reducing salt intake significantly lowers blood pressure in hypertensive patients. Lower blood pressure reduces the risk of diabetes complications.
That's reassuring, but reducing salt sounds challenging. How can I do it without compromising taste?
I understand your concern. Reducing salt might seem difficult, but there are a few tricks to make it easier. Gradually getting used to a lower salt diet is important.
What do you mean by gradually getting used to it?
Start by slowly reducing the amount of salt you use in your cooking. If you cut it drastically all at once, you might find the food bland. By reducing it little by little, your taste buds will adjust naturally.
I see, so gradually reducing salt is the key. What other methods are there?
Using herbs and spices in your cooking is highly effective. They can add flavor without the need for salt. Try using basil, rosemary, cumin, or curry powder, for example.
Herbs and spices, huh? That sounds like it could make cooking more enjoyable.
Exactly. Herbs and spices can enhance the flavor of your dishes and make the transition to a lower salt diet enjoyable. Exploring different seasonings can open up new culinary experiences.
But what about eating out or processed foods?
Eating out and processed foods often contain hidden salts. Try to limit eating out and focus on home-cooked meals. When you do eat processed foods, check the sodium content and choose low-sodium options.
Got it. I'll focus on cooking at home and using herbs and spices to reduce salt. But isn't Japanese cuisine typically high in salt?
It's true that Japanese food tends to be high in salt, but with conscious effort, you can reduce your intake.
I see, small adjustments can make a difference.
That's right. Don't try to change everything at once, make gradual adjustments. Reducing salt is crucial for maintaining good health.
Thank you, doctor. I'll start working on reducing my salt intake gradually.
Yes, healthy lifestyle changes take time.
Talking to you today made me realize how harmful excessive salt can be. Can you summarize today's discussion?
Sure. Excessive salt intake can lead to high blood pressure, which increases the risk of diabetes and other health problems. Therefore, reducing salt is a vital part of diabetes prevention.
How exactly can I reduce salt intake?
Start by reducing the amount of salt you use in cooking. Limit processed foods and eat out less often. Cooking at home allows you to control the amount of salt in your meals.
So, cooking at home is important.
Yes, and consistency is key. It's not about making a huge change overnight but gradually adapting your habits. Reducing salt intake might be challenging initially, but over time it will become second nature.
Consistency is important. Anything else I should be aware of?
Yes, maintaining a balanced diet, regular exercise, managing stress, and getting enough sleep are also essential for preventing diabetes.
I'll keep those in mind for my health.
That's a great mindset. Healthy lifestyle habits help prevent not only diabetes but many other diseases. Apply what we discussed today to your daily life, and don't hesitate to consult us if you have any questions or concerns.